Hello, I'm Dr. Elizabeth Tansey, co-director of the Washington Institute of Dermatologic Laser Surgery. Our site is involved in clinical studies to evaluate the Zeltiq procedure for the non-invasive reduction of fat in areas such as love handles and back fat in properly selected patients. I am also a member of the Zeltiq Physician Advisory Board. The cryolipolysis method of non-invasive fat reduction, first invented by Drs. Roxanne Anderson and Dieter Manstein at the Wellman Center, has been proven to measurably reduce fat layer thickness. As with any new cosmetic procedure, our clinical experience has helped us identify some key success factors to help ensure that the majority of patients appreciate the fat reduction of the Zeltiq procedure, are satisfied with the results, and pleased with the total Zeltiq experience. As medical providers of the Zeltiq procedure, serving a savvy patient base, we seek to manage the entire patient experience, which begins with the handling of the initial phone call by my office staff or a sit-down consultation with my nurse or nurse practitioner, and continues through the treatment session and the follow-up visit. From the very beginning of this process, we find it's important for the patient to understand whether they are good candidates for the procedure, what the procedure can and cannot do in terms of efficacy expectations, and what the cooling sensation and treatment experience will feel like. We also like to make certain that the patient clearly understands that the results are gradual over time and that an additional procedure in the same area might be needed to achieve the best results. Our reason for this careful approach is to ensure that the Zeltiq procedure is perceived as a high-value, legitimate procedure performed in a medical office under direct supervision of a specialty physician at our center. In this way, our patients understand that I am involved with evaluating their condition, determining the appropriate treatment parameters, planning and supervising the procedure, assessing the results, and monitoring their progress from start to finish. Like you, we want satisfied patients who will return to our practice and recommend the Zeltiq procedure to friends and family. Now let's begin. Like many aesthetic treatments, a very important part of evaluating the clinical efficacy of the Zeltiq procedure relies on standardized before and after photos. Therefore, we have our clinical photographer take before photos of the patient, focusing on the body area or areas to be treated at the very beginning of the visit. Other fat layer evaluation techniques, such as well-controlled caliper measurements, can also provide valuable objective evidence of fat layer reduction. Just prior to the procedure, I like to engage the patient in a brief discussion of cryolipolysis as the scientific principle behind the Zeltiq procedure. I think it's important for patients to understand that there is a very real science behind this non-invasive fat reduction procedure, and to separate it from other approaches like spa treatments or other non-physician treatments with no proven effect. Patients also wish to understand what exactly is involved in the Zeltiq procedure and what the treatment experience feels like. I reinforce that it is a non-invasive technology, that no pain medication is needed, how the machine works, how long the procedure will last, what the sensation of the cooling first feels like, and so on. Most importantly, I assure patients that I will be involved in planning and evaluating their treatment and will be there at the most important times of the procedure. Next, I mark the patient, indicating the targeted treatment areas. This is also a time when caliper measurements of the fat layer thickness in the areas to be treated takes place. Then, I briefly describe the device to the patient, noting that all the brains and safety features are built into the device, and that the parameters I have selected are appropriate for the individual patient. At this point, I show the patient the non-invasive vacuum applicator and the cooling panels within the applicator, along with the liner that protects their skin. I describe the cooling sensation which is noticeable when the procedure begins and explain that this sensation goes away within a few minutes. We also explain to the patient that the applicator sensors monitor the skin during the procedure and ensure that everything is functioning normally. Further, I point out the pager system that automatically alerts me or my nurse to any device issues and make the patient aware that he or she can manually activate the pager by pushing the call button. Here, I carefully apply the Zeltiq gel pad and vacuum applicator to the targeted area, again mentioning that the specially designed applicator cup uses a gentle vacuum pressure to draw tissue between the cooling plates. I advise the patient that he or she may feel a pulling sensation caused by the vacuum pressure and that there may be some temporary redness or mild bruising from this pressure after the procedure, which typically resolves within a few days. Once the cooling begins, I generally stay in the room for about 5 to 8 minutes to make certain the patient feels secure and is comfortable. I find the patient appreciates my being there at the beginning of the procedure, so I can address and resolve any unknowns that may come up for them, such as the cooling or pressure effects, positioning of the applicator, their movement, background noise from the machine, or any other questions they may have. It also allows me the opportunity to confirm that the procedure is progressing smoothly. Periodically, I like to circle back and check in on the patient. I may also ask my nurse to stop in and make sure all is well. Typically, we advise patients in advance to bring reading materials, their iPod, or even their laptop to occupy themselves during the procedure. Since there is literally no sensation in the treatment area during most of the procedure, patients are quite comfortable during the procedure. Just before the cycle is complete, my pager sends me an alert. I then return to the patient as soon as possible. Once I arrive in the treatment room, I remove the applicator and assess the treated tissue. It's very helpful to show the patient how their skin looks post-procedure to assure them that the skin is intact, that any initial redness is mild, and any other effects are slight and temporary. From a clinical viewpoint, by assessing the treated tissue in a timely manner, I can see where to place the applicator for the next cycle, keeping in mind the importance of achieving overlap and adjacent placement of the applicator on the targeted body area. There is no problem with overlapping treatment areas. At the end of the entire procedure, I review the take-home guidelines with the patient and give them a copy to take with them. This is also the time I like to remind my patient about the importance of maintaining healthy eating and exercise habits at home. Also, we strongly encourage the patient to schedule a follow-up visit in 2 to 3 months before he or she leaves the office that day. We generally introduce the possibility of an additional procedure at this time. During the follow-up visit, we may also talk about other areas on the patient's body that may benefit from the Zeltiq procedure, especially if they have been a good responder to earlier Zeltiq procedures. I hope that the patient insights and clinical behaviors presented here will help you create high value and scientific integrity for the Zeltiq procedure. As a clinical investigator of evolving technologies, I continue to recognize the importance of consistent patient communications and appropriate physician involvement to the success of a new procedure in our practice. By keeping to smart patient selection, realistic expectations regarding clinical efficacy, patient education on the technology, and physician supervision of the procedure, you can ensure your patients appreciate the fat reduction of the Zeltiq procedure and are pleased and satisfied with the total Zeltiq experience. I am confident that following these important practices when providing this non-invasive way to safely and effectively reduce fat will help make certain that you, your practice, and your patients will benefit from the Zeltiq procedure. Thank you very much.